Welcome back. According to the CDC, every 4 minutes, one person in the U.S. dies from a stroke. May is American Stroke Month, and that is especially important for us here in South Carolina. This map behind me from the CDC shows the number of stroke deaths across the U.S. You can see the darkest purple areas highlight where the stroke deaths are, and that includes many counties in South Carolina. Now, doctors say that's because of risk factors like obesity, where our prevalence here in South Carolina, you see us in red, that's between 30 and 35%. Another risk factor, diabetes. Many of our counties are greater than 10%. And that's why Midland's doctors want you to think fast and think first. The signs of a stroke can be numerous, and doctors say they can present in many ways.
It's anything that's atypical for that individual, so that could be confusion, it could be a difficulty with expressing what you might want to say, it could be a weakness in an arm or a leg.
Which is why Dr. Francisco Albert of Lexington Medical Center says the American Heart Association wants you to literally think fast. F is for face.
If you ask the individual to smile, you may see a droop on one side.
Weakness in the arms could also be an indicator. Then there's difficulty with speech.
If you ask them to speak a certain sentence and you notice that they're drooling a little bit or that they have some speech, that could be indicative of a stroke.
And finally, the T in fast is for time to call 911.
Time is the most relevant in getting to the hospital, because if you get in a timely fashion to the emergency department, there are interventions that we can do that can help people long term.
But he adds, before someone ever has to think fast, he hopes they'll think first.
It's always better to think first, really. I think preventive medicine is going to be the key to prevent these things from happening.
Dr. Albert says that's even more critical since we live in what's called the stroke belt.
So our prevalence of stroke is higher than any other part of the country. And correlating with that, our incidence of obesity and hyperlipidemia, high cholesterol, is higher. Diabetes. These are all risk factors that we have more than any other part of the country. And it's putting us at greater risk for stroke and heart attack.
Doctors say keeping your blood pressure under control and making healthy lifestyle choices like a good diet and exercise are keys to thinking first and preventing stroke in this fast-paced world. And Dr. Albert says a stroke patient generally has a window of just 3.5 hours to get to the hospital in order for intervention treatments to be effective. He says for that reason, if you think there's even a slight possibility someone may be having a stroke, call 911 or go to the hospital